Welcome to Ask the Expert. I'm your guest host, Jennifer Simmons, and today we're talking to Dr. Kerri Hesley of Associated Radiologists, and we're talking about mammograms. Welcome, Dr. Hesley.
Thank you. Nice to be here.
Can you tell me what a mammogram is?
A mammogram is, in essence, an x-ray of your breast, but a very low-dose x-ray that we perform with compression of the breast and nothing more. We take it in two views. And that's what it is.
When do you start needing a mammogram as a woman? What's the early?
The American College of Radiology and most other groups recommend beginning screening mammography at age 40. If you have a family history of breast cancer, for example, your mother had breast cancer premenopausal, they recommend screening earlier, but in general at age 40.
Why aren't mammograms recommended for younger women?
Well, for a couple of reasons. The first is we don't want to, breast cancer is not common in a younger woman, and we don't want to irradiate the breast if there's not a good reason to. And the second reason is that the breasts are extremely dense when we're young, and so we can do a mammogram, but we don't see very much.
Is there anything that we can do to prepare for a mammogram? Any special diet or anything like that beforehand?
I don't really think so. I think we usually tell women try not to schedule it right before you're scheduled to have a menstrual cycle. But otherwise, I'm not a big believer that foods affect it that much. Some women say that caffeine affects their breasts. It doesn't hurt to give it up, but I don't think it helps or matters.
Okay. How long do mammograms take to have performed?
The actual taking the exposure is a matter of seconds. But we do 2 exposures on each breast, so that's 4 exposures at a minimum. Okay. At a minimum. And so we're talking about total being in compression and having the radiation for just a matter of seconds. But of course it takes longer to position. Right. But really from getting in the mammogram room and having it done and walking out, it's usually 5 minutes.
Oh, okay. So very quick. Mm-hmm. Very good. What happens if your mammogram comes back abnormal?
Well, if you get what we call a recall,
okay.
So we want you to come back for additional views. First thing, it doesn't mean it's abnormal.
Right.
It means that there's something else we need to look at, and it just may mean that the breast was compressed differently than the last time. Something looks a little different. So what I try to tell all women if they get a recall notice is do not panic. For the most part, it's going to be nothing. And it may be something, they may have a cyst that we have to work out with an ultrasound. The vast majority of cases that are called back end up being nothing. Okay. And that's just the nature of the beast. Sometimes we can't see what we need to do on the screening study.
If someone wants to schedule a mammogram, how would they go about doing that?
Called Diagnostic Imaging Services. We are the provider for mammograms in Washington County. Okay. And we would be happy. You do not, if you're a screening patient, that is, and screening means you don't have any problems, you do not need a prescription. You can self-refer, as we call it, but you have to have a doctor that we can send the report to. Okay.
So recapping, baseline mammogram would start at age 40, we said, mm-hmm. And earlier maybe if you had a family history?
Or if you, obviously if you're feeling something, something is happening, then you need to go see your doctor, and we would consider doing one earlier.
Okay. All right. Well, thank you very much for being here.
Okay.